Measurement. We like to measure often. Most of the companies only give you quarterly data. Let me give you a thought. When you're in your own practice, how often do you think you're going to count cash? Daily. How often do you think your hospital counts cash? Daily. How often do we count how our employees feel? Maybe every 2 years. How the patients feel? Maybe every quarter. We think you need to measure often. At hospitals I work with, we put out a weekly report. We put out a weekly report. In fact, at Atlanta Medical Center, somebody's here from them, you can get a weekly report now to see exactly how you're doing. Does this mean it's valid and reliable? No, because it's not enough people. But it's an indicator. You know what else I can do? I can reward and recognize. Say, I want to come up to you and reward and recognize you, Brenda, as much as possible. Because you know what I've learned? Rewarded and recognized behavior gets repeated. How many of you feel one of the things you've struggled with as a resident, you've been over-rewarded and over-recognized? You know what I mean? Your residency director says, will you come see me, Brenda? And you say, not again. Don't they ever get tired of this reward and recognition? If I hear one more time, thank you, thank you, thank you for coming to our program, I'm going to just get sick. You know, we don't do a good job in healthcare with reward and recognizing. And there's all sorts of reasons. Number one rationalization is because why should we be? It's such a worthy work. It's so mission-oriented. But I think reward and recognition works. It can work, one, to help the individual, sometimes even to help a cause. You know who liked recognition? Sort of a glory hound. You know who I'm talking about. Mother Teresa. People look at me like I say that. How can you say that? Now, this is a Catholic nun, right? She's feeding the hungry. Don't you think she could have done that with nobody finding out? I mean, do you think she had to have cameras with her? Newsweek and Time? She let these reporters go with her. You know why, though? Because if she got recognition for what she was doing, what could she ultimately do? Feed more people. That's why she did it. I think if we can reward and recognize residents, you know what's good about it? They're going to help more patients and more people and gain self-confidence. Residency directors, guys, you think they get over-rewarded and recognized? You think the medical school, the administrator calls them up and saying, thank God that we have the OB residency program here. Just want to tell you how wonderful it is. No. So we like to reward and recognize often because I just think it works. Never underestimate the impact that it has.